4 divisions. We have the women's and children's, surgical, medicine and out of hospital. And the reason we have the out of hospital division is because we're an integrated trust, so that's a combination between an acute trust and a community services trust. We serve a population of over 500,000 and we've probably got about 6,500 staff. We have an inspector in England called the Care Quality Commission, the CQC. We have had a recent inspection and many of our areas have gone from requires improvement to good, and some are outstanding already. I think the way that we've managed to achieve that is through embedding quality improvement within the trust. So we want staff to be engaged, we want them to take control of the developments that they make in their areas. We're used to overseas nurses, and in fact actually along the south coast we have many nationalities, so the family of East Sussex Healthcare Trust consists of not necessarily English speaking as their main language, so we're very used to integrating people.
Because people have come from other countries anyway, they all appreciate how that must feel to come into an environment where you've not been before, so they'll often be really friendly and invite them out and bring them into our team in that way, and then they'll also support them at work so that they don't feel like they're so alone and so far away from home.
So the impact that our overseas nurses have had in the past is that they bring a real eclectic mix to the team, and actually in the wider community that's been the success really of having overseas nurses, because they support each other. So as a trust, health and well-being of our staff is the key to everything we do.
Here we got a big community group, so we got a social club and all the religious celebrations, and it's like a back home. We are celebrating all this Indian celebration here.
I have lots of friends working in here, Indian nurses, and I can tell one really good things we did last year. September, I think we had a big floods in India, Kerala, and I did a charity work that time in here, and I made me and my friends made some curry and rice that time, and we got £2,200 we raised for that.
Nurses from around the world, so we have lots of different nurses from lots of different places. The underlying problem most of them have when they first arrive is the difference in who leads care. So usually, not always, but usually in their own country, their expectations is that doctors lead care. And when they come here to England, there's quite a cultural shift where nurses lead care. So doctors often look to nurses as to what care prescriptions need to be done, and their expectations is that the nurses are going to give them some advice on where to go with the patient's care.
Here is like our main difference is a medicine management, and documentation is main difference I noticed. But the clinical skills is almost the same, but we will get a lot of support.
The induction when they very first arrive, and as Margaret's described, the OSCE support programme that we have in place, the support that they have from their clinical areas and their mentors in those areas, and Margaret and other members of our team actually go round into practice to either just check on how people are doing, or if necessary to work with them and go through various aspects if there's anything that they need to focus on in preparation for their OSCE.
So the OSCE programme is a 4-week rolling programme, so they practice on a ward, being supervised by a mentor, being supported by the team, so they have opportunities to practice within a clinical area. And then they come into the classroom 1 day a week. Each week is a different part of the exam that we go through. So there's 4 sessions that roll over and over. We use different scenarios for each session.
In terms of career development, with the right skills and competencies and the training, so the training is all there for you to do your role. So there are opportunities to progress through the nursing, and in fact we have overseas nurses here who are ward matrons.
Once they've got registration, we also have a preceptorship programme to support them through being a newly registered, because we know they're experienced nurses in their own countries, but being a new registrant here, so we have a preceptorship programme which they join when they've got their PIN as well.
When they come for OSCE training and we have a group of different nurses, we introduce them all to each other. So they're all working together as a group, so they have opportunities then to network, liaise with the other members of the group that are also undertaking this exam, and work together to practice out of, obviously when we're not here, weekends, evenings, when they're trying to do study is to practice together. So they've got that little network already set up. Yeah, we are very pleased with our OSCE rate actually. Our nurses get through the exam really well. And we found that doing the OSCE's preparation in the way that we do it prepares them really well, because we give them a demonstration, we give them opportunity to have like a mock exam, yeah, we give them feedback on how they're doing, give them tips and hints on how they can improve to be able to achieve.
ESHT is a really nice place to work, it's really friendly.
Yep.
So really good luck with your interview, and we really can't wait to meet you. Really looking forward to it.
Good luck.
I think it's just the teamwork and it's like being a part of a family really, working for East Sussex Healthcare Trust.
ഈസ്റ്റ് സസക്സിലേക്ക് വരിക. ഇവിടെ ലോട്ട് ഓഫ് ഓപ്പർച്യൂണിറ്റി ഉണ്ട്. അതുപോലെ തന്നെ നിങ്ങൾക്ക് നല്ലൊരു ഇൻ്റർവ്യൂ പാനലാണ്. നിങ്ങൾ ഒരു തരത്തിലും സ്ട്രെസ് എടുക്കേണ്ട ആവശ്യമില്ല. ഇവിടെ വന്ന് ഒത്തിരി സപ്പോർട്ടീവാണ് ഈസ്റ്റ് സസക്സിലെ എല്ലാ മെമ്പേഴ്സ് ഓഫ് ദ സ്റ്റാഫും. അതുപോലെ നിങ്ങളിവിടെ വന്ന് ഒരു ബാക്ക് ഹോമിലെ ഒരു ജീവിതം ഇവിടെ നിങ്ങൾക്ക് ലൈഫിൽ ജീവിക്കാൻ പറ്റും. സോ ഇവിടെ വന്ന് സെറ്റിലാകാൻ വളരെ എളുപ്പമാണ്. അതുകൊണ്ട് നല്ല ഇൻ്റർവ്യൂ പാനലാണ്. എന്തുണ്ടെങ്കിലും ചോദിക്കുക. അപ്പം ഓൾ ദി ബെസ്റ്റ്, ഗുഡ് ലക്ക് ഫോർ ഇൻ്റർവ്യൂ.
നിങ്ങൾക്കെല്ലാവർക്കും എൻ്റെ സ്വാഗതം. ഞാൻ കേട്ടത് 100ഓളം നഴ്സസ് കോൺഗ്രസിലും ഈസ്റ്റ് ബോണിലും ഈസ്റ്റ് സസക്സ് ട്രസ്റ്റിൽ വർക്ക് ചെയ്യാനായിട്ട് വരുന്നതെന്നാണ് ഞാൻ കേട്ടത്. എല്ലാവർക്കും സ്വാഗതം. ഞങ്ങളുടെ എല്ലാവരിൽ നിന്നും നല്ല ഹെൽപ്പ് നിങ്ങൾക്കുണ്ടായിരിക്കും. നിങ്ങൾ ആരും മടിക്കരുത്. എല്ലാവരും ഞങ്ങളോട് എന്ത് വേണേലും ചോദിച്ചാൽ ഞങ്ങൾ ഹെൽപ്പ് ചെയ്യാനായിട്ട് ബാധ്യസ്ഥരാണ്. എല്ലാവർക്കും ഞങ്ങളുടെ സഹോദരന്മാരെ പോലെ ഞങ്ങൾ സ്നേഹിച്ചുകൊണ്ട് നിങ്ങൾക്ക് എല്ലാവർക്കും വെൽക്കം.